Hello, my nursing students, fellow nursing students, or people that has been in the nursing field for less than a couple months. I just want to get out here and tell you guys the stuff that they don't tell you in nursing school about nursing. So, the first one, everything you learn in nursing school, other than like the medications, all that stuff, completely different. Everything you learn in nursing school, you're not gonna use. You're not gonna use. It's completely different once you get on the in that field. Once you're on the floor, like completely different. I was so lost because I'm like, they didn't teach us this in nursing school. They didn't. I don't know how to do it. They didn't teach us this. You have to go with the flow when you're a nurse. When you're a nurse, especially a new nurse, because most of the times I'm not gonna say that. Well, they kind of spot you out. That you can tell who's new. That's all I'm gonna say. And also another thing, um, if you're looking for like a doctor's office job, they're hard to come by. They're very hard to come by. And also, they do not pay like y'all think they pay. Not a doctor's office. A doctor's office is going to lowball you. At least the ones where I stay at. I did the doctor's office. I did two different doctor's offices, y'all. I was a nurse for maybe 2 years with the first one. They were paying me $14 as a nurse. Not an MA, but as a nurse. Now the second one I worked at, I have been a nurse probably for about 5 or 6 years, and they would pay me $16. And I took that only because I wanted to get out of the long term care setting. So I took that, and I was like, maybe it'll change. But that was like, this is the absolute most we can pay you. Okay, and I have a story time about that later on if you guys want to hear that. But yeah, they don't pay. They don't pay at all. Long term care pays. It pays good, but the hours are 12 hours. It's really hard to find like an 8 hour long term care. If you find that, baby, stick with it. Stick with it because mostly everything in the nursing field is 12 hours. Um, like I said, in the nurse home, they pay well, but everything's 12 hours. My bad, y'all. My child just came in and interrupted. But like I said, everything is 12 hours. Um, Private duty nursing, same thing. You can find some 8 hour private duty nurses. If you find those, stick with them. I am on a 12 hour private duty nursing assignment right now. I just work Friday, Saturday, and Sunday. I was supposed to be at work today, but I've been getting over COVID, so bear with me. Um, yeah, but private duty nursing, it pays well. But be prepared to be the CNA and the nurse, okay? So if you don't like changing diapers or cleaning up throw up or anything like that, baby, private duty is not for you. Nursing home either, because if you're a good nurse, you'll be out there with your CNAs working with them if they need your help. So, like I said, doctor's office hard to come by, pays the least. Long term care pays good, hours are long, as well as private duty. They pay really good. It's just, you're gonna do it all. Okay. And also they don't tell you in nursing school about sundowning. Okay. And if you guys know what sundowning is, let me know in the chat. Okay. But sundowning is the worst. Okay. I'm telling you, it is the worst. Some of them get so aggressive, some of them get nasty. Just depends. But yeah, sundowning after once the sun go down, baby. They always think night shift has it easy. No, I'm telling you, I'm like, we are dealing with a whole different person on night shift. Y'all get the sweet Miss Betty. We get the Miss Betty that want to call you the H word, that want to call you the B word, okay? And I've been called both, okay? So trust me, I didn't seen it all. I didn't had men come on to me trying to touch, and I'm just like, look, and all you can do is redirect, 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 redirect. And yeah, it is horrible, okay? And also with the same thing with the full moon, baby. I'm telling you. It gets real in the nursing home. It gets real. You can ask anybody that has ever worked in a nursing home, baby. It gets real quick. Okay. And some other things about nursing. Like in nursing school, you learn to like warm the water for the bath and all that, baby. You don't have time. You don't have time. Crush the pills separately. You don't have time. Now, remember that for when the state comes, okay? When the state comes, everything you learn in nursing school comes back. Okay? Everything comes back. Ain't no, I forgot. No. When it comes down to the state, everything has to be by the book. Okay? Everything has to be by the book. And they don't want to hear that you forget. No. Everything has to be by the book when it comes down to state. Mama. And y'all, another thing, like when it came down to long term care, the reason I really leave long term care is because I always work night shifts. Night shifts will work best for my family. I always work night shifts, and it always came down to the administration. They always down on night shift. Like, night shift don't do nothing. Y'all don't do nothing. Stand the CNAs. And I'm looking at them like, our stuff is way better than the day shift. Looking there, all our charting is done. Like, and I'm that nurse. You take it down, I'm gonna take it with you. Okay, because I'm not gonna sit there and let you play us like that, because they always be like, well, night shift don't do nothing. I didn't came in and work days plenty of times, and everybody's sitting at the desk till 9 o'clock. Your patient not getting changed. You're not charting. You ain't pushing no medicine. Everybody's sitting down till 9 o'clock, but you coming down on us because we have to pick up what day shift leaves, and then it puts us behind. But I'm gonna tell you, I go there with you very quickly. Okay. So that's just a couple of things that they don't tell you about nursing school, about nursing. So if you guys want to know more, just let me know in the chat. Also, if you want to hear those story times I have about the doctor's office as well as the nursing home story times, y'all, I got a lot. Okay, so if you guys want to hear that, just let me know in the chat. Okay. Until next time, I love you guys.